The American Joint Committee on Cancer Staging has recently produced the 8th edition of the staging system, and this introduced a novelty as compared to the previous editions. In fact, together with the classic anatomic stage classification that remains valid, they also proposed a prognostic stage classification that integrated both the anatomic stage and the biologic factors. So this was based on the demonstration that biologic factors like hormone receptor, HER2, and grade have an independent prognostic value that is independent from the anatomic stage. So they proposed a new classification that integrates both these aspects. So our group has conducted a large randomized trial for HER2 positive early breast cancer patients, which is the ShortHER trial, that randomized more than 1,200 HER2 positive patients to receive 9 weeks or 1 year of adjuvant trastuzumab in combination with chemotherapy as adjuvant therapy. And we aimed in this study in a post-hoc analysis that was published after the final results of the ShortHER trial were released. In this analysis, we aimed to evaluate the role of anatomic stage and prognostic stage, and to somehow compare the performance of the two different stage classifications. So the first result we had was that classification by the prognostic stage downstaged up to 42% of the patients to a more favorable stage category as compared to the one they were assigned according to the anatomic stage. And this is based on the fact that the HER2 positive status is considered a poor prognostic factor, but it is a positive predictive factor for the efficacy of trastuzumab, and introduction of trastuzumab has completely changed the prognosis of HER2 positive disease. So quite large proportion of HER2 positive breast cancer patients in our study were downstaged by the prognostic stage to a more favorable stage category. And when we compared the performance, the prognostic performance of the prognostic stage and the anatomical stage, we found a similar prognostic performance. So therefore, although the prognostic stage downstaged 42% of the patients, the performance of the two systems remained very similar. And then we also wanted to explore another aspect. So we only considered patients categorized as stage 1 by anatomic stage or by the prognostic stage separately. And we looked at the outcome of patients according to treatment arm, 1 year versus 9 weeks of trastuzumab within the stage 1 category. And in patients that had an anatomic stage 1, the outcome was similar in the group of patients treated with 9 weeks or 1 year of trastuzumab. And within the prognostic stage 1, the outcome was numerically worse for those patients treated with 9 weeks of trastuzumab as compared to 1 year of trastuzumab. So our conclusions were that the prognostic stage is valuable in counseling patients and may serve as a reference for clinical trial design. However, based on our data, we were not able to support a prognostic stage as a guidance to de-escalate the duration of adjuvant trastuzumab.